Welcome to Let's Talk Liver, our new podcast covering all things liver health, as the name suggests. I'm Jacki Seaward, a nurse working with the Hepatitis Foundation of New Zealand, and I'll be your host. During each episode, I'll be talking to someone working in the liver health field, and we'll do our best to answer all your questions and teach you everything you need to know about keeping your liver healthy. This is our first episode, and we're very excited, and I must admit I'm a little nervous. To start us off today, we'll be talking to the Hepatitis Foundation of New Zealand CEO, Susan Hay, here to talk about the rates of hepatitis in New Zealand and share the work that the Hepatitis Foundation of New Zealand does. Susan joined the Hepatitis Foundation in 2012 as part of a team delivering the Hepatitis C pilot. She then held the Hepatitis B Program Manager and Operations Manager roles before becoming the CEO in 2016. Good morning. How are you today, Susan?
Good morning, Jacki. Very well, thank you.
It's wonderful. Thank you for coming in today and sharing your valuable time with us. So how are you and what's your role, Susan?
Right, my name's Susan Hay. I'm the Chief Executive of the Hepatitis Foundation. So my role is to work with about 20 fabulous staff. We've got 10 hepatitis nurses who work out in the field, and we have 8 administrators sitting here in our central helpline in the office in Whakatane.
Fantastic. So what does actually the Hepatitis Foundation do, Susan?
So primarily we follow up in the community around 17,000 patients who have viral hepatitis B. We provide education to the patients and their whānau, all about looking after themselves with hepatitis B, how important it is to get regular blood tests, which are usually 6 monthly. And education plays a big part of what we do to ensure that patients are enabled to look after themselves.
Fantastic. So I did hear you say there's 17,000 people registered with the Hepatitis Foundation. Wow, that's a huge amount to look after. So I suppose my next question is, what is hepatitis B?
Well, hepatitis B is a virus. There's a number of different types of hepatitis. There's hepatitis A that you would get, that would make you sick that you would get through eating contaminated food. Hepatitis B, I'll talk about shortly. Hepatitis C has a cure now, and that's a different type of hepatitis. Hepatitis B is a virus, and it affects the liver. Most people who have hepatitis B live normally with it, with no problems, no adverse health effects at all. And it's important, though, that they still continue to get regular blood tests so we can monitor the health of their liver. The people who have hepatitis B in New Zealand are mostly those who haven't had a childhood vaccination for hepatitis B. So that's likely to be those people born after 1988, round about there when universal vaccination came in. So if you're older than 30, you probably should ensure that you've had a test for hepatitis B, particularly if you are Māori, Pacific or Asian.
That's fantastic. And it's really nice that you've clarified the different hepatitises, because there always seems to be such a stigma and discrimination against the different viruses and things. So moving on, can you please tell me the statistics in New Zealand and how many people actually have hepatitis B?
Right. Yes, so just following on the people who are likely to have hepatitis, prior to childhood vaccination, those who have hepatitis B have attained it mainly through their mother to child transmission or from playing in the playground. So there's really no stigma to having hepatitis B. The statistics in New Zealand, we have around about 100,000 people in New Zealand who we expect will have hepatitis B.
Wow.
But about half of those have been, are likely to have been identified through their GP, and half of those again, or just a little bit less than half of those again, are on the Hepatitis Foundation community follow-up program. So out of the 100,000 who are expected to have hepatitis B in New Zealand, hepatitis B disproportionately affects our Māori population, our Pacifica,
Right.
mainly from Tonga or Samoa, and also our Asian Chinese New Zealanders as well, who have come from China. They have different types, different areas where they do childhood vaccination in China. So those Chinese New Zealanders also are disproportionately affected by hepatitis B.
Right. And what you're saying, though, is when you look at it, when you look at the Tongan and the Pacific Island and the Chinese populations, those populations are really rising in New Zealand. So, you know, it goes without saying that these people need testing just as much as our own Māori and stuff.
That's right, and it's all about their whānau and their families as well, because many Tongans and Samoans will go back home to Tonga or Samoa and have family here. So it's really important that they have regular testing for hepatitis B to make sure that their liver health is okay.
And I think what you said before about there being no stigma and discrimination against Hep B, because it usually is from mums or childhoods, but those are probably the barriers why we aren't catching those 100,000, I'm guessing.
Yes, I agree with you, and it's the education, isn't it? It's understanding that actually it's innocently acquired. Most people are healthy and will have no adverse effects, but it is important that they have those regular 6-monthly blood tests just to make sure that their health and their liver is doing okay.
So going from there, I suppose one of the really important questions is, what is the Foundation's goals for the future?
Right, so New Zealand is one of 196 countries that signed up to the World Health Organization targets to eliminate viral hepatitis by 2030. We've got 10 years left to try and eliminate hepatitis B. We will get there eventually in the years as the childhood vaccinations roll over, but it's our older cohort of patients, who didn't have vaccination that we need to keep an eye on, especially as we are an aging population as well. Our goals are to work in partnership with primary health care providers, our GPs, our midwives, our prisons, our migrant and refugee groups, to work in partnership to provide education to those health providers and to the patients that they serve. So it's about working in partnership and ensuring that none of their patients fall through the gaps and are not followed up in the community. So our goals are about providing education, continuing to follow up patients who are registered with the Foundation's monitoring program, making sure their GP is kept informed of the patient's status, that they are being cared for, and ensuring that we're all working together in partnership and that we're not working separately from our GP and midwives, etc.
So it sounds like you're really offering a real wraparound service. Does it cost anything, Susan, to be part and registered with the Hepatitis Foundation?
No, our services are free to patients who are registered on our service. If you are a New Zealand citizen or a resident and you're eligible for New Zealand healthcare, you will get all of our services free, which includes visits if required to do any education.
That's absolutely fantastic. And I think we'll leave it at that, Susan. I suppose my last thing is there any take-home messages from our podcast today that you'd like to share with everyone?
Yep, I think it's really important that we keep working towards trying to ensure everyone who has hepatitis B in New Zealand is identified. Once they're identified, it's having those regular checkups and ensuring that we keep all of our New Zealanders safe who have hepatitis B, and by working together in partnership, we should get to those WHO targets by 2030 to eliminate hepatitis B.
Fantastic. Thank you very much for your time today, Susan. I hope you have a lovely day.
Thank you,
And
Jackie.
everyone, stay tuned. Next week, our episode is going to be talking to Dr. Alex Lampton-Smith. He's going to cover hepatitis B a little bit more in depth. Hope you all have a nice day.